video, you will understand how CPR techniques change depending on the victim's age and how AEDs can restore normal heart rhythms. Before utilizing the AED, it is important to know what environmental factors may occur, including flammable surfaces, metal hazards, harmful gases, wet environments. As an AED has electrical discharges, it could ignite and cause fires within areas such as oily surfaces or with gasoline. The next one is metal hazards, and while it is generally safe to be able to use an AED on a metal surface, whatever you do not let the pads touch the metal surface. The AED pads can cause more harm than good by provoking sparks that burn up the chest. There are gases you should avoid when using an AED, which are flammable and may risk explosions, such as methane, propane, butane, and high-level oxygen tanks. Wet environments are high conductors of electric shock, which is why it is very important to dry the victim and yourself before utilizing an AED. As previously mentioned, you can locate AEDs in your community using apps you may have downloaded on your phone. But if you are inside a building, you can locate them with signs and directions. Another thing to take into consideration would be the expiration dates of the electrode pads of the AED, which is very important as you do not want to be running on dead batteries in an emergency situation. The first question is, why do electrodes even expire? To answer the question, within the pads, there are gels that provide adhesion between a victim and even though it makes about 2% of it, in which cardiac arrest can be monitored properly because it's so complex. It can provide adequate timing and measurements needed. However, the gel also begins to dry out as time moves on, and the gel also breaks down. This means it cannot stick to the skin as well, and monitoring cannot be done properly. To avoid this, you can often look at the hourglass icon located on an AED pad. This will tell you the expiration date and whenever the pads will be considered dead. This is when you need to change them out for new ones. Starting with the AED, as soon as you receive it, there will probably be a casing over it, which you want to remove. You will notice that they have full-on instructions and methods of how to use this. Even if you don't have any prior instruction, you will be able to access this. Your AED will prompt you with a series of voice recordings that will teach you on how to conduct it. The AED will also display pictures where you can put the electrodes according to what is shown. Before applying the electrodes, you want to make sure of two things. One, that the patient has no hair on their chest in which it can block the receptors, attach adhesives to rip off the chest hair, and two, the patient is completely dry on their chest so that you are not at risk of electrical shock. Other special considerations include pacemakers, which also are located near the same area the electrodes also go, in which you would need to adequately work your way around as shown. So you will start by ripping them off, and then your AED will tell you exactly what steps you need to do. As you can tell by this one, this electrode will go right here on the patient's chest. One will go on the patient's side. Then this part will be plugged into their machine. Now, you may be wondering, why are the electrodes placed in a specific way on the body? As you notice, one electrode is placed directly on the chest while the other one is placed more off to the side. This is known as anterior lateral placement, which is when one is positioned on the right side, specifically under the clavicle, and the other one is placed on the left side. This creates a continuous flow of electrical current all around the heart as it is sandwiched between the two electrodes. As the heart itself is also not symmetrical, it needs to be placed at a diagonal instead of a straight line across. When your screen says OK, and when it tells you the directions, you will press the red button. In an emergency situation, it is most likely that others will be around to assist you with the AED, which is why it is extremely important that before you press the button to shock the victim, clear has been shouted. Clear basically means that everyone else will back off and will not have any contact with the victim and the shock will be administered. If the clear message is not given out, then individuals who are assisting may also be affected with the shock when it is unneeded for their own body. Remember to continuously follow prompts after the shock has been delivered, and also keep in mind of your safety. As this series has been mostly about adult CPR and adult administration, it is also time to talk about how children and infants go through CPR and how their methods differ. A differentiation in CPR within children is the depth and compressions that will need to be given. If the child has not underwent puberty, which is usually between ages 1 to 8, their compressions should not exceed 2 inches, as too much can damage many ribs and many organs. Moreover, depending on the size of the child, you may also need to use one-handed CPR instead of 2 hands. However, with infants, you will not need 2 hands nor 1 hand, but simply 2 fingers, the index and the middle finger, pressed up in the middle of their chest gently. Likewise, children also need compressions of 100 to 200 BPM. Regarding rescue breaths with children, it often depends on whether you perform CPR by yourself or with another specialist. If a victim happens to gain consciousness during CPR, it is known as cardiopulmonary resuscitation-induced consciousness, or CPRIC for short. It is when patients exhibit signs of awareness or movement while receiving chest compressions. This usually occurs in younger patients, but you should be equipped with the knowledge of how to handle it no matter the individual. The goal is to maintain CPR with as few interruptions as possible, often by reassuring the patient and even physical restraints.
How you can learn
Healthcare providers often have ketamine, but usually patients don't recall pain as the lower levels of oxygen to the brain cause memory dysfunction.
Becomes more worldwide. Columbus, Indiana especially has CRH, Columbus Regional Health, as a resource in which you can learn adequately on how to use these skills you've learned. I myself have found great interest in learning about how to save lives, especially when I became connected through my own CPR training, in which I received my certification. You yourself can raise awareness on this issue, as many people lack the skills and training they need to save lives. By implementing these skills into your household, you, your family, and your friends will be armed with the tools to make a difference and overall create a safer lifestyle. Thank you.